Mark the floor with tape where you want the person testing vision to stand. Use the pre-cut rope to measure 3 meters from the marking. Use the duct tape to mark the floor at the end of 3 meters. Once both ends of the floor are marked, make sure the rope is firm when held at waist level. Turn the iPod to the maximal brightness. Instruct the patient to stand at one end and not to lean forward during testing. Clean the eye patch with sanitizer. Hand the eye patch to the patient and demonstrate how to cover the eye. Stand behind the line and hold the iPod at 3 meters. Instruct the patient to cover the left eye and read the letters as they appear. Allow them to read at a comfortable pace and make sure they are not squinting. Start with the letters at 20/40 size. Whenever the patient gets the letter correct, click the iPod screen to move to the next letter. If the patient gets none of the letters right, move to the 2200 size. Repeat the testing for the other eye by asking the patient to cover the right eye using the eye patch. Record the patient's visual acuity and the number of letters they got right on the screening sheet. You will show 1 letter at a time and 4 letters per size. Patient keeps leaning over the line. Ask the patient to make sure their full body stays behind the line so you can accurately test their eyes. Patient has difficulty seeing the screen. Adjust the height of the iPod to the patient's line of vision. Ask them if this is a good height and if they can see the screen clearly. Patient doesn't cover their eye completely. Ask the patient to firmly hold the eye cover over their eye for the whole test. Patient says a number instead of a letter. Tell the patient there's a letter on the screen and to make their best guess as to what it is. Patient won't say anything. Ask the patient what it is, if anything, they see.